We are live.
And we are live. Hey, everyone. This is Prison Break with Shirley,
Shonda.
and we are here for a very special edition. We have a very special guest here with us on today. And so we want to welcome Dr. Freeman. Give me a second. I have a second thing going on here, and I don't know why. So give me a second.
Okay.
All right. There we go. Bear with us. This is our first time going YouTube live from the Zoom room. So you know how sometimes you have hiccups, but we won't let that get us down. But we want to welcome Dr. Edward Freeman, phenomenal person. We're going to let him introduce himself, and then we're going to get started with our disclaimer. So Dr. Freeman, go ahead and introduce yourself to the good people of the world.
Okay. My name is Edward Freeman. I'm a physician. My specialty is psychiatry. I am the CEO and president of Manfred Associates Professional Consultants, and I am a air medical examiner for the FAA, and I am also a senior air medical examiner and a HIMSS with advanced training for the FAA as well. So I wear a couple of hats. I'm here in Central Texas, and I don't really know what else to tell you about me. I'm supposed to be phenomenal. You kind of set the bar kind of high there, so.
It's okay. You can live up to it. I am very sure of that. And so before we get any further, everyone, we're going to allow Miss Shonda Curb to go ahead and give us our disclaimer.
So, you know how we do every week, everyone. We have to get the disclaimer to be on the radio airwaves on today. So I'll just give a quick, short summary of how it goes. The thoughts and views that are expressed on our show in this evening belong to the host and the guest. They are not the views of KRGN or their underwriters. Everything that is said here on this evening belongs to the guest, and it is their responsibility to uphold their words. So that's all we have on this evening for this disclaimer. I'm really excited to talk with Dr. Freeman tonight, and I'm so excited for everyone that's joining us, Shirley. This is our second week talking about men's health.
Yes. Absolutely. And so we have a professional in the field that's going to be giving us some different things, everyone. And so you want to buckle your seatbelts. You want to stay tuned for this next hour and a half as we dig deep into men's health and men's mental health. We know that these are topics that sometimes we don't talk about, especially as Black people. We don't sometimes talk about it. And so we're going to dig right in. Dr. Freeman, don't do that. I know you're ready. If we don't talk about it, who's going to talk about it? They don't know firsthand, but we do. So you've already given your title. First of all, explain to the people what it really is that you do, because I know a lot of people don't really understand what your titles mean. So if you can kind of break down those things.
So a lot of people can't distinguish between a psychiatrist and a psychologist. And they say, yeah, I know one prescribes medicine and one can't. And also, if you have a PhD, you're referred to as doctor as well. But the difference between the two is that all psychiatrists are physicians. You could be an MD, which is medical doctor of medicine, or you can be a DO, doctor of osteopathic medicine. And those two are equivalent. They're equal to be the same. So what that means is, yes, we're able to prescribe medications, but that means all of us in our training have done internal medicine, obstetrics and gynecology, pediatrics, of course, some psychiatry, but also surgery and medicine. So we are trained in all major disciplines of medicine. Now, do we specialize in them? Actually, yes, because in order to have a specialty in psychiatry, which is the treatment of diseases of the mind, not the brain, the mind. Now, the seed of thought is in the brain, but your body, if things go wrong in the body, that can affect how you think and feel. So we do have to be very well versed in all branches of medicine, but we don't practice all those. So that's the big difference. A psychologist does therapy and counseling, and they usually do the testing. So that's the big difference. And that's one that I have to deal with on a regular basis, but that's it in a nutshell. Okay. I lost you.
Sorry. Yes. So I know a lot of people don't know the difference between those because as a whole, we don't generally seek help in those areas. So, knowing the difference between them and not being afraid to go seek the help that is needed is what we want to display on today. And so, both Shonda and I are in the health profession. I'm a registered nurse, and so like you, when we go through schooling, when we go through our degree plan, we don't just know. We don't just know the basic med surge, but we have to go through the OB and all of those different things. And so coming up on the military side, we had to learn, military nurses, we had to learn every single thing, because if a civilian nurse, if they weren't comfortable going, guess who had to go? And we didn't have a choice. So we had to be well versed in every single area, all the specialties. And so, but then you can go and you can specialize in those different things and get more knowledge and training in those different things. And then Shonda, in her own right, in her professional world, and you can talk for yourself, I'm not going to talk for you. Go ahead and tell the people what you do.
So I am a pastoral counselor, and what that means is that I operate through whatever it is your faith system is or your system of belief in order to help you walk out your journey of personal growth and development, whatever that looks like. And so sometimes that means that I don't necessarily use Christianity. It just depends on who comes and sits with me. Me using the word pastoral really tells more about who I am versus who someone else is. I sit with people who have many different faith beliefs. It's just a matter of, do you need the help that I provide? And so I am trained in clinical mental health. I went to Mary Hern Baylor to get my master's of marriage and family therapy. So I am trained in clinical mental health. I'm also trained to be a pastoral counselor. I've been doing pastoral counseling for, ooh, gosh, maybe 10, 10 to 13 years, but somewhere in there. I've been working with the community to really progress in the area of growth and mental health and conscious development. So that's a little bit about what I do. I use all types of different types of expressions and therapies. I use a little bit of breath, a little bit of play, a little bit of body, everything that I can, because it's all interconnected. They all work together to create a system of wellness for each person. So it just depends on what each person is in need of. And that's just a little bit about what I do.
Awesome, awesome. So we're gonna bring all of those pieces together and be able to talk about men's health on today.
Yes.
So, Dr. Freeman, um,
Yes.
tell us what type of, and we know you're bound by HIPAA law, so you're not going to be giving us any personal whatevers, but tell us kind of a short day in the life of Dr. Freeman where you get a male patient that comes in and they may come up to the desk and they have an appointment with you, but they come there and they don't really say the main problem. So they're not telling the front desk personnel what's going on with them. They just say, I have a headache. But when they get back to you, it's more than likely a different story, correct? Can you kind of unfold one of those pieces?
Well, then that's not uncommon. People will come in with your typical diagnosis, as people say, anxiety, depression, things of that nature. And it's so common that I don't really listen to, I mean, when people tell me the diagnosis, I don't necessarily run with that, which wouldn't be a good thing for me to do in the first place. But yes, and actually, it's really not that different between men and women. Both have a lot of stereotypic ideas of what psychiatry is like. They really have a stereotypic view of what psychiatrists are like. And I learned a long time ago. Initially, I was asked if I was interested in doing surgery. I did a rotation in surgery and I really enjoyed it. I thought it fit my skill set very well, but the lifestyle just didn't work. I really didn't enjoy the long hours. And what I noticed in a lot of the younger surgeons, their home lives were pretty bad shape. And I knew early on that that was something that was going to be very important for me. And I think psychiatry picked me. So,
Okay.
the thing that I noticed when I said, okay, this is what I'm going to do, I immediately realized that I don't fit the norm of what the other people I saw, in terms of how I carried myself, my views, things of that nature. But the one thing I understood when I trained in Chicago, because I'm from Chicago. And we did a lot of training at the Cook County Hospital in Chicago. So that's the west side of Chicago, that's home for me. So I spent a lot of time, people say we don't get a lot of it, but almost every patient I saw for the first year and a half were African Americans. I saw very few people of any other color. Now, granted, a lot of them were extremely ill with the schizophrenia, things of that nature. I didn't see as much of the walking wounded, the people who are, for the most part, do well, but have problems. No, I didn't see a lot of that. But I cut my teeth on treating Black folks. So for me, it wasn't that unusual. I didn't realize initially that, hey, this is something that we don't do a lot of, because that's all I was seeing. And I was spending most of my time trying to be comfortable, realizing that, early on, you're so busy trying to do what you're taught to do and follow the rules and sometimes follow the book. Like I said, for me, the big thing for me was the question was, am I going to be able to fit this? Because I just don't fit the norm of what I was seeing. Now, granted, the majority of people I was seeing were European in nature, in terms of, even though we were treating African Americans, there were very few African American physicians. But while I started training, I ran into a gentleman named Carl Compton Bell, who just passed it'll be a year in July, in Chicago. And he was very, very prolific in the African American community. He started the No Crime Day. He did a lot of the things that we're coming back to on a national level. And he definitely didn't fit the norm. He didn't fit the norm. But he was a brilliant man. And, he took me aside. And when I was training with him one day, he just looked at me and said, you don't feel like you fit in, do you? I said, no, not really. He said, good. If you ain't fitting, then he says, because first and foremost, if you're not yourself, you're not going to be able to do this.
Okay. That's good.
If you ain't fitting in, that's because that's not who you are, and you're not trying to change. So you're good. Those weren't the words he used. They were much more colorful, but nevertheless, the point was across. And so I went forward and found it's true. The more you are genuine with yourself, the more patients are going to be comfortable with you. So I get a lot of them, particularly here in Central Texas. Not only do I get the African-American males, many of them are military or ex-military. And so we have that layer on top of it of, everything's okay. No matter what, it's okay. And so to bring people in who don't trust you, don't want to be there, and they come for various reasons. Most times they're made to come, not necessarily by orders, but because something in their life has forced them to face something that they really don't want to face. So yes, it's difficult. They come in, and so we start peeling layers. And the one thing I've learned a long time ago is I have to try to be where those people are. So in our early conversation, I'm asking general questions, general medical questions, which immediately throws them off. They're not used to, they're thinking we're going to lay on a couch and talk about potty training or what have you. And, I let them know that this is a medical meeting, a lot like what you should be seeing if you're going to your primary care and things of that nature. Now, the way I ask the questions and the questions I ask may be geared more towards psychiatric and psychodynamics, but it's going to be the same thing. So as I start asking them questions, I ask them detailed questions, they don't always become more comfortable. But part of the reason why I ask them the questions is to get them to think. As they start thinking, they start forgetting about how uncomfortable they are. Because there's some pretty detailed questions. As I said, people come in and say, hey, I've got anxiety, depression, and my depression this and my depression that. And I'll say, what do you mean by depression? And they'll look at me and say, well, don't you know what depression means? I said, absolutely, but I have no idea what you're talking about. You have to explain to me what you're feeling and experiencing that you or someone else calls depression. So the number one thing we're doing is I'm getting a clearer picture of who they are, but I'm also getting them to think, and I'm getting them to connect the dots between what's been going on in their lives, maybe for a long time, maybe for a short time, and how they're responding and acting now. So they're not used to this. So a lot of times the questions, they have difficulty. And I told them, if you can't answer the questions, it's okay. because it's twofold. One is to get immediate information, but the other is to get you thinking long term, because rarely do these things just pop up in a day or two or a week or two. And these things start taking over time. So, and we have the complication here of what goes on in their career, especially if they're military and they've had combat related things as well. So it gets complicated there too, but nothing we can't handle. We're still going to start from the beginning, because what was the baseline of this person before that? Let's say their troubles or trauma, and let's say that trauma is from the military. What was their baseline before they were exposed to that? Everybody doesn't come into exposed to trauma nice and fine. Many people are broken. Many people are cracked before that even happens. So, we have to find out where that baseline was. The big deal we have now is these people have been deployed so many times, they don't remember what they used to be like. Part of the things that happens is conditioning. They keep training, they keep training, they keep training. Well, congratulations. We now have conditioned you to be the way we want you to be. And they don't remember the before or after. So we have to deal with that too. So it's kind of a juggling act. I'm naturally curious about people. So the more complicated it is, the more I enjoy it. But I also realize that no matter what, that we're dealing with another human being. And I realize that oftentimes they're going to want to tell me things. They're going to tell me things they may have never told anyone, including themselves.
Yes.
Yeah.
And so I'm very cognizant of that. And the one thing I hear all the time with Doc, this is going to freak you out. Doc, you're going to think this. And that's just, well, I don't think you know what I'm going to think. But you're assuming that what you tell me is something I've never heard before. And if it is, okay. If it's not, that's okay too. It says, but I'm not here to judge you. I'm here to evaluate you. Now you're going to have to determine if this is good, bad, or ugly. That's not for me to do. For me to do is understand what's going on with you and how is it impacting you. So typically after a 30, 35-minute conversation, usually we've kind of broken the ice. We haven't necessarily gotten to the crux of anything, but we've broken the ice. But because I do this also is a double-edged sword. It sets me up because they see me as their counselor, their therapist. Well, counseling and therapy is just exchange of ideas and information. And that's what we're doing. I'm actually taking a medical history, just like another doctor does. However, I'm asking more detailed questions. And I'm asking things that relate to their psychological, emotional well-being. So they don't see it as medical. They see it as counseling. And that's fine. That's fine. But yes, oftentimes I hear things, especially from the guys that say, first 5 to 10 minutes, I was ready to walk up out of here. I didn't want to be bothered with you. You were upsetting me. Those aren't the words they use, but. And I tell them, I says, I understand, but I have got to get you focused and I've got to get you thinking in a mode that you probably haven't thought of. And the few times you did, you found it uncomfortable and didn't want to do it. So I found a very direct, straight approach works. Especially when we talk about something very emotional. When they see you as straight, no chaser, they tend to be, especially soldiers, they tend to be they appreciate it. That's the way they like it, straight ahead.
Yeah. We're both veterans and we can attest to that.
Okay.
Just give me the bluff. Stop playing with me.
But when we get into areas that you don't get into much, because one thing that I've learned, that's not an area that the military tends to spend a lot of time in, that emotional and psychological. I mean, it makes strong people, very strong people. So even though you like it straight, no chaser, when it's right between the eyes in an area you haven't been before, it can be pretty difficult. So you have to try to, how much force and how much pressure do you put on this? How can you appear non-judgmental but still appear caring? It can be a juggling act. I actually have a little bit of a plus on my side, because most of these African-American men don't expect to see an African-American man talking to them.
Yes.
So
and I'm so glad to have you in this field, because we need more of you.
Well, there's only 6 of us.
Wow.
Wow.
No, I'm just kidding. I think I think there's only one other African-American psychiatrist, male psychiatrist in the area, and he does mainly child and adolescent psychiatry.
Okay.
Scott and White may have some because they have a residency training program. So people come through to train, but many of them don't stay. Now, could they have one or two on staff that I don't know about? Absolutely. The military is going to have a few. But out here in the civilian world, there's not many, not here. But that does work to my advantage. It has always worked to my advantage. Even when people underestimate you, people often drop their guard when they think you're somebody other than the physician. I did a lot of emergency room work in Houston in the medical center. And for me, scrubs didn't fit. So when we were on call, I used to wear workout clothes and t-shirt. And one day I went into a room, I left my coat out of the room and I walked in and the guy said, "Oh yeah, come to get that mop?" I said, "Okay, we'll take care of that." I said, "Hey, why are you here?" And he explained to me he was there to get some pain medications and things of that nature. And I said, "Oh, okay. You come off?" He says, "Yeah, whenever I need some, you got to play that game, but you get it and you go." I said, "Oh, okay."
And he you were the one he was supposed to be getting
I didn't, I said, "Well, we're going to," he said, "Well, that mop over there, that mop and bucket, it's not smelling." I said, "You're absolutely right. And I'm going to get somebody to take care of that. But Howard, that's not what I came in here for." I says, "I'm the physician that was coming in to evaluate you." I said, he said, "Oh, I thought you," I said, I know. I know what you thought.
Can you stop right there? How did that make you feel for another Black male to assume that you were the help?
Actually, he wasn't Black. This was
He
a
wasn't
Caucasian
Black. Okay,
man.
so that kind of clears it up. All right.
But people in general can misjudge. I don't have a problem with it at all. When I was in college, I went to school that had 23,000 students and 250 Black people. I learned early on that while they were misjudging me, that put me at a distinct advantage. And I've never been one to care a whole lot what people thought about me, Black, white, purple, or green. So,
that's good.
But I understand it though. I understand. The thing I learned early on is people who don't think a certain way about you, you're pretty much not going to change their views. And if you do, generally you're an exception to their rule. So, if a person's important to me and I care about them, then yes, I'm concerned about what they think. If it's a person who has power, influence, and things of that nature, then their views are important because it can affect me. But the general population, I don't worry about it. I don't worry about it. If we haven't been able to prove our worth to people in these hundreds of years, I don't know if we're going to. Again, there's things we can do to make people treat us with respect. But having respect from someone is how they think or feel, and I can't waste my time worrying about that. You better treat me with respect, but you don't have to respect me.
Amen.
So I use that to my advantage. And there are several times I've walked into a room, took off my white coat and walked into a room just to see what kind of reaction I would get. Now that may be a little sneaky, but I'm going to use whatever I can. And if they want to make an assumption, that's okay. Plus, it's sometimes fun to see the look on their face. But yeah, I those microaggressions, those micro insults can wear you down and wear you out.
They can.
I'm not saying they're not important, but we've got to move on from that. We know that we're valuable. When I was in college, they were talking about how we needed to prove to them, because we're so few, that we were as good as them. And I said, I know there was a time when we did that, but ladies and gentlemen, if you're running a race and they tie one foot behind your back, pluck out one eye, and start you 10 yards behind them and you beat them, then you're not as good as them. You're nowhere near as good as them. You're a whole heck of a lot better than them. And so why are we trying to prove to them that we're as good as them? We're better. They haven't survived slavery. They haven't survived things we survived. We are better. We are a chosen group of people.
Yes.
Well, out of the mouth of the man himself.
Yes.
That's empowering, Dr. Freeman, to hear. I don't want to make this about age or race or anything like that, but the people on the radio don't know that we're not quite the same age, me and Shirley and you.
Yeah, because y'all are older than me.
Sure.
Well, I don't know, that might be up for debate, but it would seem actually the opposite. It would seem that you might be our elder in terms of those things. Not old, just
I'm pretty sure.
a
Oh
little
yeah,
older
you're
than us.
right. You're just older than I've ever been.
Okay.
Yeah.
The oldest you've ever been. And so just a little older than Shirley and I. And so then you've been in places and spaces and experienced things that we haven't by virtue of that age. Also, by virtue of you being a man, there are a lot of things that you've experienced that are
Oh
different
yeah.
than Shirley and I. So to hear you say what it is that you're saying at this particular point, I think is very, very important, because one of the aims of the show that we have really this with Prison Break is to break down walls, mind, body, and spirit. And a lot of times the walls that we're breaking down are those thought processes and beliefs that keep people from being all it is that they can be, because they feel that they're limited. And nobody else has placed this limitation on them. It's what it is that they believe about themselves. So to hear you say something that's so impactful that could tear down so many different walls for so many different people, especially for our young men and women who are coming up behind us that really don't understand what the fight for equality really is all about, because they're on the tail end of what it is that we're doing. That's so important to hear the elders pass down. You don't have to attempt to try to be equal with anyone, because you're not. You're better, and then you just need to live that. Like it's a situation where you have to know it and walk it for yourself.
Absolutely.
So to hear you
Yes.
say it, then thank you so much for that confirmation and for that empowerment from you as our elder. We really, it's invaluable. It's
Keep
invaluable.
saying that
You know,
elder
you can
thing. I
never.
don't know about that.
Well, it's important that
It's
we
true. I
acknowledge
know. It's all
people,
right.
you know, who have made room and made spaces for us that are coming up
Well,
behind you.
you
And
know,
even if it's me and my daughter, I would be her elder. And my daughter wants to be a psychologist. And you know, she did that because she heard me say too many times that if you wanted to be rich, don't be a counselor. So she,
Amen.
right, you know what I'm saying. But even still being an African American woman and having two master's degrees and operating as I operate, I have cleared some paths for her. I have laid some foundational walking stones for her to be able to forge a path for herself, but still within her own greatness, and also for other young Black women that come up behind her. So even though I'm not too much older than my daughter, I'm only 16 years older than my daughter, I'm still old enough to have
It's a
forged that
lifetime.
space for her. It is a lifetime. It is a lifetime. And so I'm assuming that because I'm under 40, that
Oh yeah, I'm y'all elder. You right about that.
okay.
I'm not under
Yeah.
40, but I'm not too
Yeah.
far gone.
Yeah.
So then
But you know,
thank you for
but you know, you forged a way for her, not because of the degrees, but because of the process. Because kids listen to what we say sometimes, but they always pay attention to what we do.
Yes.
Yes.
And,
Yeah.
you know, I do a joke with my daughter, who just graduated here in May. She graduated from Sam Houston State. She's a forensic chemist. Well, I don't know what the heck they do, but I always tell her, you know, I'm going to empower her. I said, I'm going to empower you. And she looks at me like, Dad, what are you talking about? She says, I see it on TV that I'm supposed to empower young women to make them strong and realize something. She's like, what are you doing? I says, I'm just being silly, because you've been empowered since the day you were born.
Yeah.
You've been empowered by the fact that you said you want to do something. I said, let's get about getting it done. Didn't say, well, should you do that because you're a girl? Should you? I said, I don't care what you want to do. If you want to do it, let's get it done.
Yes.
And how are we going to do that? That's it. I mean, we don't have to do this artificial, you know, you are strong, you're about. That's good. That's important. But it's really what we do day to day.
Yes.
And like I told you, this is what you want to do. Have you done the things you need to do that today? What do you mean? Get it done.
That's good.
Just like my son. Have you done today what you're going to? Yeah, that's it. So, and yeah, which is a reminder that she is a forensic chemist. Me and my wife are both biology and chemistry majors. I am also a forensic psychiatrist too. I forgot about that. The forensic part just means legal. And so I'm trained to do expert testimony, things of that nature. I really don't do it much because when I got into that, my kids were about 4, 5, 5, 6, and I realized it was going to take such a tremendous toll on my time with them, I just tabled it. It wasn't worth missing that time
Can you
with the kids.
can you speak to that portion of, because I know in the medical community there is a great sacrifice. And if husband and wife are not on one accord when it comes to rearing the children or and your career, there can be a tremendous pulling apart because of that. And I heard you say more than once that you decided that that was not something that you wanted to do. So your priorities were your family.
Right.
Can you speak a
Right.
little bit on people who have, kind of pulled away, in their marriages, in their relationships, speaking from, of course, the male perspective, because that's the only perspective you can speak from, and what you would tell the head of the home, the king of his castle, what would you say to him, someone who's warring with their career versus their home life?
Well, I tell, it was kind of an epiphany for me when I was in medical school because I thought I was pretty good at surgery. I was smart enough to keep my mouth shut. And I found out from the people that did it, I was. But when I started seeing some of those residents, how chaotic and torn their family lives were, I realized I didn't get where I was because of my intelligence. I mean, I guess it's because of the grace of God, but he put me with a family that gave me a solid foundation because you all know, you're both professionals. As African Americans, they're going to throw all kinds of roadblocks, traps, misdirections, miscues. Some of them are intentional, some of them are not. But we're able to navigate because we have a strong foundation. And that starts at home. And for many of us, home and church. And so I knew that no matter what I did, if I was gonna have a family, I had to commit to that because that's what I had. And so I wasn't like, well, I'm gonna have 3.2 kids. I said, no, this is not gonna allow, I cannot have a lifestyle that has my family acting and treating me the way I see these people. And I felt for them. And so some of them I actually talked to. Which is one of the reasons, like I said, psychiatry picked me, because I'm talking to my supervisors and saying, hey, what's going on here? And a couple of them were Black, and it's like, I said, well, first of all, if you all aren't one in core, then you got a match made in hell. Regardless of what you do, there's going to always be a problem. So you all are going to have to find out what it is that's important to you and what you share that's important. Sometimes, especially professionals, are all about the degree and the money and the career. And, if your life, if your home life, if your foundation is poor, you're going to, first of all, eventually be miserable, no matter how much money you make or what you do. Absolutely. So, I spent some time talking about that and talking about what they really wanted from their families. And I found out that most of them were really about, they say, hey, I want to be able to do the best I can for my families. But understand, the best thing you can do for your family is make sure they have you, not things. And, I have no idea if that was successful or not. A couple of weeks later, I was gone. But I talked to brothers now, and many of my patients, and especially young guys, said, do you realize something, that God has given you a strength and a dominance that no one else has? And I says, well, have you noticed in your family, if you have children, the mom can be there all day long, yakety yak, I told you, walk in the room, snap your fingers, and the kid's like, Now, part of it's because you're not there a lot, but another part is because she has the power of life. She can give these kids life. You can help spark it, but you can't, that's it, you're done. The rest of the 9 months ain't up to you. And that is a tremendous power, the giver of life, the sustainer of life. But we have this other part that is about making sure that these children have discipline and understanding. And we're given that role and we're given that strength. Now, if we use it, that's another story. Are women devoid of it? Absolutely not. But I tell them, you have the power to change these kids' lives for the better or worse with the wave of a hand, with an appearance of you, a couple hours a day or a couple hours a month or maybe a couple hours a year. And I said, so what do you think about this? Yeah, man, that's powerful. I said, that should frighten you. The first thing you should feel is fear. To have that kind of power, to be able to evoke that kind of to put that child on that kind of arc in their life, that should frighten you, because you can do so much good or do so much bad. And that means you should be responsible, because to whom much is given, much is expected. And so, another thing is yeah, you're the king, but I like to use the Navy thing. You might be the captain, but the XO is the runs the day to day.
All right now.
Mhm.
The captain makes the final decisions. When all else fails, when all's on the line, the captain's going to tell you what to do. But the captain relies on the executive officer as well for every day to day to find out what's going on, to be the conduit between it. Because sometimes if you're that powerful, especially powerful male entity, you can be seen as, even if you're not, you can be seen that, well, we've seen this threatening to everybody else out on the street. You can be to your kids too. My kids used to always go to their mother because they said, well, Dad, all you're going to do is say is no. And I said, no, I don't. Yeah, I guess I did. But it was okay because they could go to her all they wanted. If me and her were always on the same accord. But
That
what
is
was
so
interesting
important.
as they got, yes, but as they got older, especially my son, when he got on his own, I would hear from him initially, maybe once a week. Yeah, I think I got home about a couple of months. I was hearing from him every day. And I said, you haven't called your mom. Yeah, I'm gonna call her. Well, what about this? What about that? And then one day I said, well, why don't you ask your mom? She don't know nothing about this. I said, oh, so that person you went to all them 18 years that you didn't, she don't know nothing about this, Dad. I said, well, you'd be surprised with your mother now. But I get what he was saying. That he understood that there were things in life that from watching him growing up, that, hey, I need to consult with somebody I knew definitively knew how to handle this. Now I could tell him, your mama knows how to handle it too. So, but that was interesting. And so that's where the balance comes in. Each one has a role to play, and they kind of interconnect and overlap, and they're not black and white. And the thing that I tell the guys, understand, when you have that power, it's not necessary to wield it. I'm the king of the house. Everybody knows that. If you have to say it, then you really ain't
And you're
the king.
not. Right.
Good.
That's real good.
So, sometimes the toughest thing you can do is to be gentle.
Mm-hmm.
I spend a lot of time talking to brothers and sisters about this a lot, and I enjoy seeing my patients. I learn more from my patients than I'll ever learn from me. I've learned a lot of stuff. The reason why my son graduated on time is because one of my patients who worked at the institution where he went, he said, hey, is your son, did he do this? I'm like, no. So it's a give and take. But we've got to understand that we don't always have to be on the same accord, but we need to be on the same page, and we need to present a united front. It's okay if one is a little lax in discipline, one says yes more than the other, but they need to understand that when it's all else fails, what we say goes.
Yes. Yes.
And the kids don't like it. Like I used to tell my kids, well, I want to hear what you had to say about it, but when it's all said and done, you're gonna get over and do what I told you to do.
Right.
It's cool. We don't like that. I said, I hear you, but see what happens if you don't get it done. You really ain't gonna like what's gonna happen then. And as I told them, you really ought to be very careful about upsetting your mother. See, because I'm gonna tell you what I'm gonna do. She ain't gonna tell you. It's just gonna happen.
That's good. That's so good. That's so good, Dr. Freeman. You're on here giving us pearls tonight. I don't know if the people that are listening actually know what it is that they're receiving, but you are giving us some really dynamic information to take back with our families and to really to settle some things for ourselves about our interactions with each other and about being with each other and about being with ourselves, honestly, because that's most of where our issues lie, right? Is with ourselves, not necessarily with each other. So I really want to ask you, Dr. Freeman, and you talked about this a little bit before when you talked about your day to day with men and how a typical day could possibly look. And I think we asked this question last week, but I always want to get it from different sectors about how much more difficult is it to work through mental health issues with the young men it is that you're seeing that come in and speak with you, and what are the barriers sometimes to them being able to have those vulnerable conversations?
Well, I don't know if there are any barriers. My job is to figure out where these young men or people lie, and to communicate with them on the level that's understandable to them. There's always going to be some stuff, no matter what you do. You're going to find out down the road. There's some stuff they just didn't tell you, and that's
Sure.
okay. Um, wow, I don't. I don't think that I have a whole lot of problems with communication. A lot of it is the implementation of what we communicate. We can talk about what to do, but can you get it done? And so that's where a lot of things come in. And a lot of it have to do with the interactions they have with the significant others in their life as well. Now, that's one of the things that sometimes it takes a while to find out, okay, this guy is not being successful because sometimes the other people in their life don't understand.
Hmm.
Yes, that's a big
And
problem.
I tell them, I says, well, they don't understand and you don't understand.
Mm-hmm.
So if you don't understand, how are they going to understand? And I says, that's one of the things that you want to spend some time doing, communicating with them to get them to try to understand where you are. And now they always can't be empathetic or even sometimes sympathetic, but they can intellectually understand if they have that ability. Uh, it's a lot, especially with the gentlemen that are keeping back um, wartime things,
Mm-hmm.
because they often become very isolated, very withdrawn, very irritable. And I tell them, I says, and they'll tell me, look, I know my whole family is suffering. I know they are. And, sometimes that's the greatest pain they have, that they know that what's happening to them is inflicting pain on their family. And they'll share that with me. And the first thing I tell them is, did you share that with your family? No, no. I said, why not? Your family cares. They want to know. So if you tell them what you told me, at least they know that you care. Because sometimes they look like they don't care. They're just,
Mm-hmm.
yeah. And so I says, letting your family know that they mean enough to you, that it hurts you, that you're hurting them, that gives them a reason to hang on. It's also the first start of talking about what's going on with you. You may not want to give them the gory details, but you can let them know enough that this is the kind of thing that's hurting you. And if they don't seem to get it, then let's get back together. Get together with your counselor, get together. We can come up with some non-combat scenarios that they can relate to, they can understand. Now, some of those things can be still pretty brutal, but it helps to make people empathetic and sympathetic.
Mm-hmm.
One other thing I always want to say about families too. The one thing I used to always tell my kids, and I still tell them, I love you, right? Yeah, yeah. Did you know I like you? I've always liked my children. I've enjoyed being around my children. They're funny, they're fun. And I see a lot of people that seem like being a parent is a chore.
Mm-hmm. And a lot of
And
that come out in coronavirus season.
oh, yeah. But kids sense this. Kids are instinctual beings.
Mm-hmm.
And if they feel like if it feels like it's a chore, if they feel like they're a chore, then they're not going to feel good about themselves. And the first time I told my kids, they just kind of looked at me like, huh? You like us? I said, yeah.
Mm-hmm.
Oh. But now as young adults, I hear them saying things like, yeah, they're doing it right, but I don't think their parents like them too much. They're getting what that means, and the greatest joy I've ever had is raising my kids. I learned so much from them.
Yes.
Thank
Wow.
goodness. I don't think I had a whole lot to get them, but I learned so much from them, and it's been a joy, and it's been fun. And nobody ever tells you that. They tell you how hard it is. Yeah, all this gray hairs from them, and all the ulcers and the late nights, but then no one tells you it's flat out fun.
Mm-hmm.
If you go about it the right way. Now, what's the right way? Whichever way is right for you.
Mm-hmm.
Okay, good.
But a lot of us, if we weren't raised, then we don't know how to raise.
That's so true. Yeah.
And so, again, I was so fortunate. God granted me the blessing of having parents Ooh, boy, yeah, they were, boy, and my father, oh, he was something else. But yeah, and so, and they were not around to see any of my children born.
Okay.
Oh, wow.
Yeah, I know. And but as things went on, and as trials and tribulations, I started remembering things that my parents said, my parents did, and started realizing, oh yeah, that was the right thing to do, and I'm gonna do that right here, right now. My poor kids, but you have that instruction book inside of you, and if you still have family members, especially parents, if you still have them around, ask them. Sometimes you look at your child and think there's something wrong with them. And you say, "Oh no, Johnny, you did that when you was 6." I said, "Oh, okay,
Mhm.
all right."
Yes, I
Yeah,
look at
something wrong with them. They just like me.
yes, I look at my children all the time, and I can pretty much see and can't get mad because I know that's something that I did exactly. I'm like, okay, that's me. Let's deal with it.
There you go. So,
Yes.
yeah, but being on one accord, I mean, it takes work. You're not going to just, yeah, you got love and that's cool and that's wonderful, but you have to work at these relationships, and you're never going to agree 100%. And you're
Hmm.
still going to do stuff that's going to get on each other's nerves. Man, and the longer you be around each other, the more they're going to do stuff to get on your nerves. And so what?
Good. That's good. That's a good point
My
too.
Shonda goodness. Yeah, so I'm gonna stop.
Y'all
We're
know what I'm talking about.
We do.
Yes,
I'm a
absolutely.
little bit over halfway in this broadcast, so we just want to attune those who are just now tuning in with us on Prison Break with Shirley and Shonda. We have very special guest, Dr. Edward Freeman, here in the local Central Texas area, enlightening us on a very important topic: men's health and men's mental health, but all around family stuff. So just because you're not a man or whatever your status is, go back to the first beginning of this show and watch it from the beginning. You are going to gain some valuable nuggets. All right, so we can continue on now. Dr. Freeman and Shonda, we want to get over to a topic about coronavirus.
Okay.
We couldn't let this pass by. So, Dr. Freeman, I want you to speak to it on both sides, um, because we have been told that you contracted coronavirus.
Yes, I'm a survivor. Yes.
Yes, you are a survivor. And so, can you speak to us from the medical side first, and then from a personal having had it and recovered from it, both of those standpoints?
Sure. So this coronaviruses are not new. There's multiple coronaviruses. This one seems to be a little unusual because, and we don't know why. The big problem we're having here is general baseline information is not being disseminated. It's not gotten out. Typically, what happens is the CDC, the NIH, all these kind of people, your Department of Health, they put out information. They've tried to do that, but this has all become so politicized that it's just not getting out, and it's not getting out in a cohesive, coherent, repeatable manner.
Mm-hmm.
So, it's like anything else. The void is being filled with whatever people think or believe. And now, now we're trying to open back up and come back out and to get the money rolling. The things people don't understand is they said the corona incidence was flat. So people assume that meant it was gone. No, what that means is it's just sitting there consistently, like a calm pool of water. It's not going up, it's not going down. You jump into the water, you're gonna get wet.
Mm-hmm.
And we knew this was gonna happen. Interestingly enough, they're saying that the incidences from most of the protests haven't been as high as they thought.
Mm-hmm.
And it's been about 3 weeks, so we'll see. But that's because a lot of people wore masks and they were outdoors.
Mhm.
So you're still going to get some incidents. You're going to get some transfer. But not as much. And we knew this. I don't want to start talking about coronavirus itself. I mean, I don't want to start getting people going. So Dr. Freeman said, but
And you don't
I am
have
not a
to.
virologist. I'm not an epidemiologist. I'm not a public health person. I'm a psychiatrist.
Mm-hmm.
But I can speak it from a personal
Yes, that's what we want.
and just the quick dirty of it is I spent 2.5 weeks in the ICU and another week in the step down unit, and came home and spent about 3.5 weeks recuperating. Now, to go back to what happened, I don't know where I contracted it. I remember getting sick one day, feeling kind of feverish. Suspected that might be it, because you're always going to have the worst case scenario. But about 2 or 3 days later, I started noticing I was getting worse. And then one day, it was hour by hour, I was starting to just a downhill slide. And felt really, 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 really weak. Didn't realize it was because I wasn't really breathing very well. I didn't feel short of breath. I just wasn't oxygenating very well. So I was moving fine, but it just wasn't doing well. So went to the hospital, and they put the pulse ox on your finger to see how you're oxygenating. And before I could even look at it, a lady grabbed me by the back of the neck and said, "I know you can't walk, so I'm gonna drag you."
It was that.
Took me to the ER and stripped me, put me in a gown, put me in a MRI. And the last thing I remember was in saying ICU bed 6.
Wow.
And that's where I stayed for about 2.5 weeks. Never had to get intubated. However, my kidneys decided to take a little vacation. I'm not sure where they went. They didn't send me a postcard, but they did stop working completely.
Wow.
So didn't have had no GI problems. Thank the Lord I didn't have any GI problems, because I couldn't move. And didn't have any cardiac problems. Significant and severe respiratory distress syndrome. Significant. But the kidneys stopped working. Just silly kidneys. So they put me on dialysis, which for me is interesting. Speaking of the psychiatric thing, I was reminded by me that kidney failure was something that I had lurked in the back of my mind most of my life, and that I kind of feared. I had a close relative who was on dialysis. And so it was kind of one of those kind of, childhood, I hope that don't happen to me. And throughout my life, I've had protein in my urine, no big deal. Some people have that. So it was always been on my mind. And I'm like, well, here it is. And 2 days later, they put in a temporary cath and put me on a dialysis machine.
Wow.
So this machine is sitting right next to you. Of course, I can't move, but it doesn't matter. You're plugged in anyway, watching all your blood leave your body and going to this machine. And it was when the machine was running that I realized that this person died while they were on the kidney dialysis machine. So it's, and the part that I'm talking about is the personal journey that one experiences. And, I realized that because I was getting so sick that I really could have died. I didn't know if I was going to, but I really thought, and somebody asked me, said, so, well, weren't you afraid? And I said, surprisingly, no. When they told me my kidneys had failed, I wasn't afraid. But I had learned a long time ago that I am where I am, not because of me, but because of the grace of God. So I just simply, I didn't make them lies. I'm not going to cuss. I ain't going to smoke. I said, look, I trust you. I don't know what you're doing. I don't know why you're doing it, but I trust you, Lord.
Amen.
That's it.
Amen.
So whatever's going to happen is going to happen. So it doesn't even matter if I understand or not. I trust you. And that was an interesting journey. Because then after that's when I found out the kidneys failed. So I faced a lifelong fear. Didn't bother me. I was like, aren't you supposed to be afraid? Yeah, well, why aren't you? I don't know, shut up. No, don't remind yourself. And these are the kind of conversations I have in my head, when I realized that, and that person who was close to me to die was my father.
Okay.
And so, I spent a little time thinking about his death, and it was me that discovered that it was malpractice. So, a lot of things. And I was like, okay, so this is what God wants me to do. I ain't sure why we're going on this journey, but here we go. Buckle up. And
only do it.
it was enlightening.
Yes.
It was enlightening. Facing your fears, facing some very dark times in your life. I realized that things happen for a reason. And for me, this journey was more about that inner journey, I guess Jesus went through the desert.
Mm-hmm.
Yeah, I went through COVID.
Mm-hmm. Come on.
And there's lots of temptations. There's lots of things to be afraid, lots of, and it just wasn't. It just wasn't. But what I realized is that there was, and you could feel it. There was so many people praying for me.
Mm.
You could feel the love. You could feel it. And I just thought, when I got back, I started calling people, and they were like, I said, thank you for that thing. Thank you for it. Yeah, I was praying for you. I didn't want to call you, but I said, I know you were. I could feel it. And it was at that point I realized I was a wealthy man.
Man.
Because you can't buy love.
Yes.
You can't buy caring. Mm-hmm. You can buy friends. They're not real ones, though. And, there was a couple of times after I started getting better, I felt a little anxious. And I think they really wanted to send somebody there to talk to me because they didn't believe that I could be so, I wasn't cavalier, but I could be so matter of fact about it.
Mm-hmm.
But one of the doctors said, well, you're very lucky. I said, this is not about luck. Mm-hmm. I said, the things that happened in my career, the things that didn't happen in my career, I said, this was not luck. This is what God intended for me. Mm-hmm. And so, he ain't gonna let nothing happen until what he wants is complete.
Yes.
And he just kind of looked at me and said, I get it. Some of us don't, but I get it.
Uh-huh.
Wow.
And,
everything we go through.
And interesting enough, because he was Muslim. Mm-hmm. He said, I get it. I said, good. I'm glad you do.
Yes.
I said, but I'm not afraid. Mm-hmm. What is that going to do for me? It's not going to change anything. Mm-hmm. And since I know he got me, whatever he wants to happen is going to happen. Mm-hmm. So, and some people find it strange that a psychiatrist, they think we're very agnostic or all this anti this, anti that. But like I said, if I tell you my story, how I got to where I am, it's nothing but grace. Nothing but grace. And there have been times in my life where, no burning bush. And this is one of those times where I know I got paid a little special visit.
Mm-hmm. Yes.
Yeah.
Wow.
So,
but
yes.
It's so interesting that you talk about being wealthy because of the love and the care and the prayers that you have from people who cherish you. One of the things that we've been talking about recently has been about mending relationships and about making sure that, it's been a big topic that I don't know if you've had a chance to look at any of the other ones, but we talked about kind of really working through healing from some of the things that you went through as a product of growing up, dealing with your parents, issues with your parents, or what they did or whatever they didn't do to affect you, and really forgiving them and mending those relationships, and sibling relationships and mending those, and spousal relationships, and making sure that, that you're doing what it takes to keep people in connection with you, because that's the way that God designed our lives. And I don't know why God chose humanity as the vehicle through which he wants to conduit love to everyone, right? Because he gives it to us directly, but he also provides that natural connection of people and love with people to sustain us. And so it's really amazing that you would hit that point in the way that you did, not only to hit that point, to make that point, but for it to be so poignant with your situations that you would definitely hit on the fact that we need those connections, that love, and how important it was, and how cherished you felt, and how it kind of uplifted you some to know that those people were praying for you and what that did for you.
Mm-hmm.
Yes. Well, you're talking about relationships. I'll touch on this, but we can't continue on this because we need about 6 hours. I got a phone call, and I don't remember a lot of it. It was probably when they were considering intubating me. That was bad. I got a phone call, and it was my daughter. Now, the interesting thing about my daughter, she's 30-something years old. That's probably the first time in 12 years my daughter's called me.
Oh, wow.
Yeah, now she's from a previous relationship, did not have a good relationship with her mom, did not have any relationship with my daughter, and I've spent the last 12 years trying to have a relationship with someone who has fought me tooth and nail, which is my daughter, not to have it. And you ask, why did God do that? Because God is love. That's what God is. And so God wants us to do that same thing. You know, why did God give his only begotten son for us? It's love.
Love. Yeah.
That's all he wants us to do. So I don't remember much of the conversation, but it was so important to me that I remember feeling better from that point forward. Now, I'm sure I felt better psychologically and emotionally, but the fact that she called, the fact that I know, so that means she cares.
Yes.
You know, and I did not raise my daughter. And I spent the whole 30-something years and the 20-something years with these two kids, be reminded every day that I did not raise her. And I've never talked about this publicly, and I'm not going to talk about it a whole lot until I talk to her, but she has called me a few times after that. And it's incredible how you feel when that person does that. And for me, the fact that she initiated contact, because she never does that. And since then, we've been talking, just a little here, a little there, a little there, but she's trying. And to know that that child loves me, I just wish I could get her to understand how much I love her. She doesn't understand one of the reasons why I got to medical school is because of her, because I knew I had a child. And no matter what happened, no matter what they did, and they tried to stop me, I knew I had to be able to provide for this child. Now, as it turned out, I really never was. I tried, but I wasn't able to. I really tried. It's interesting how the courts treat men.
We need another show for that too, Dr. Freeman.
Oh yeah,
but
it's interesting, you know. And then we're in a mid Illinois town, and it was interesting. A black man who's a physician who ain't in a jumpsuit. What are you doing here? The good news is everybody in the courthouse knew who I was. But at the same token, the courts didn't give me any relief. And I wasn't trying to take her. Or there wasn't a custody battle. I just wanted to visit her. I just wanted to raise my child. And anyway, this is a tough one. But the point of it is, you know, I have not known will I ever give up. And I told her, I said, you know, you caught me probably at my worst moment physically. I've never been that ill before. And literally it started turning around. So, you know, love, see, here's the problem with love. People think of love as being weak because love is quiet. But, you know, you all are science people. So, you know, the randomness is what the world wants to do. You leave everything alone, it just goes to, and people look at explosions as being powerful because they tear things apart. But imagine what it would take to keep something together in an explosion. And that's love. But it's quiet. I mean, you know, okay, it doesn't boom and make noise and throw stuff around and tear stuff up. But it just sits there quietly and keeps all forces from acting negatively upon something.
Wow.
So people don't see love as powerful as it is, but it has got to be one of the most powerful forces. Because like I said, after that phone call, and I don't even remember the phone call, I just remember she called. I do remember telling her, if I don't make it, please know that I love you. And I remember the doctor coming in that night and said, man, you're looking a little better. I said, well, you got a little boost. You know, he said, no, I don't mean looking. We're looking at your numbers. You're getting better. I said, I had them kidneys. Nah, they still ain't here. I said, okay. You know, I mean, I know it's the grace of God, but my child turned my life around with a simple phone call. That's how much her love means to me. So, but that also tells you how destructive, if you're thinking negatively, things can be. And letting go of past pains. And people think that if they let go and they forgive, that means it's okay. That's not what you're saying. First of all, forgiveness is about you. I'm not going to carry this burden anymore. I'm not going to hold this against you. Now, what you did was wrong, and you may even have to pay for it, but I'm going to let this go and move forward. people look at that. No, I will not be ignored. You're not being ignored. I'm not going to forgive them. You're forgiving yourself. And by the way, if you don't forgive, how you expect to be forgiven?
Yes. Yes. Man.
So, you know, there's a song, I know something about God's grace. Well, I know a little bit of something about it, because let me tell you, COVID brought my daughter back.
Amen.
And I got a chance to spend a little time with the Lord.
Yeah.
And he showed me some things. And yeah. So I am grateful for this journey. I don't recommend it. You know, it's not something I would put on an itinerary,
Right.
but I am so grateful for it. I am happy that it happened because I learned so much about me. And I think it made my daughter realize that, you know, I do care. And I used to tell her, I said, you know why you're so angry with me? Because you care. The opposite of love is not hate. The opposite of love is indifference, to feel nothing.
Yeah.
Which is one of the reasons why folks treat us the way they treat us, because they know, first of all, we love, and they know we're very special. Question, somebody's going to say something.
I was just going to be really transparent in this particular moment. I am over here doing my best to hold back this flood of tears. Why am I holding it back? Or why do I have tears?
Cry all the time. I don't care if nobody see me cry.
Because Dr. Freeman, I don't have the options that other people have. Some people have different modes of crying. I only have one, and it's an ugly cry. And we on camera live, and all of this will be exposed. So I'm gonna do my little, I don't want to mess up my makeup dab right here in the corner of my eye. Because, you know, I can't speak for anybody else. I can only speak for myself, but I know the struggle of working through conflict with a parent at an adult age. And it's such a mix of emotions and past stuff that kind of don't matter no more. Like, but it matters to you. You know what I mean? Okay, so it's just such a mix of things. But to hear that even in the midst of something that could have taken your life, that God was so mindful of your situation that he would build that bridge for the two of you to be able to find your way back to each other.
And I'm not an easy person. You see, the problem, she doesn't like conflict. And I'm just transparent. And I think she doesn't believe, you know, when I say something, she's like, no, you can't be that way. Yeah, I am this way. I said, as a matter of fact, if you let me explain to you what happened, you think you're mad at me now, you may be more mad at me after I tell you what I did and why I did it.
Yeah.
I said, but I don't care. All I want you to know is the truth. I don't want you to hate me or to feel bad about something based on misconceptions and lies. I want you to know the truth. If you don't like me, I want you to have a good reason. I said, but I know that's not true. I just want the child to know I love her.
Yeah.
You know, that's my firstborn. And I'm proud of her. You know, and she also has my first two grandchildren. And so, you know, I've never stopped loving her. I never will stop loving her. And I think she's a little rockhead. She's coming around.
She must be the one of your kids that's the most like you, Dr.
Right, I was gonna say that.
Probably not. I think my youngest daughter is. Oh man, she's like, I love it when she makes a decision. Well, Dad, I'm gonna do this. Why? Because of this. I looked at this, I looked at that. I'm like, I love you, girl. My wife and my son are like bookends. And nothing wrong with them, of course, but it's just when I'm talking to them, I'm like, okay, y'all are saying the same thing the same way to say. Again, it's nothing wrong with it, but I can be very analytical, even about emotional things. And so I think with my oldest daughter, when I reveal to her, it's just so, here it is. And she's like, no, it can't be that simple. Nah, you're full of it. It's that simple.
Mm-hmm.
It's
So
that
it's
simple. I think she's starting to realize, but she was so angry.
Mm-hmm.
She was so angry.
You know, anger has a way of putting a lens on things that completely distorts whatever happened. Even even in your private time when you're marinating over whatever that thing is that you're angry about, sometimes you have to check yourself, like in the moment, like, wait a minute. Did I really? Maybe they didn't say it exactly like that. Maybe, you have to do that for yourself. Like when you think back over it, because anger has a way of making things appear a way in your mind that they didn't really happen. It has a way of putting an inflection and a tone on somebody's sentence that was never there.
An
in the first place.
interpretation. Yes, ma'am.
Absolutely. And
especially if you don't talk.
Especially if you don't talk.
We were just texting. So
people think that time will make that a little bit better or a little bit easier, but time actually helps to distort it a little bit more.
Oh, well, here's another thing too. We're talking about from the time she was born till she's about 16 or 18. So she's also interpreting things that she wasn't even able to understand.
Correct.
Mm-hmm.
Correct. From a child's
That's
perspective.
one of the things I told her. Yeah, I said, if you don't want anything to do with me, okay. But please allow me to explain to you what I did. And I'm not going to make excuses. Like I said, after I finish talking, you may not really like me. And I'm okay with that, as long as you know the truth. Not something you thought of, not something somebody told you, not something you envisioned, not something you imagined. But that's a whole nother subject. We can be here for this.
No, this is helping somebody. This is helping somebody. However, I believe in however the conversation veers off to, those people that see this are the people that are supposed to be to see it.
We done veered.
We always veer, Dr. Freeman. We always veer. It's okay.
Because we're talking about someone I love.
Yeah.
And someone I'm proud of. So I really don't have a problem talking about it. I really don't.
No, this is beautiful, Dr. Freeman, because it gives a vivid picture to the things that we've been discussing about how important it is as men to be available to your children, to be there, and what it can do to you if you're not there, and what it can do to your child if you're not there.
Yes.
And how it can affect.
And I was not there.
Family. Yeah.
I was not there. I tried to be there. I wasn't there. And I told her, I said, one of the things that I'm not trying to make up for that. I can't make up for that. I just need to know you're okay. Now, I would love for us to have a great relationship with my grandchildren, the whole bit, all of that. But if we can't, as long as I know that you're okay, and as long as I know you've resolved a lot of these issues, I can live with that. That's not what I want, but I can live with that. But I am your father. And whether you realize it or not, I am affecting you every single day.
Mm-hmm. Yeah. Absolutely.
And I realize that. And I realize how important I am in your life. I don't know how it fits. I said, and that's because that's what God gave us. And I says, and I promised God I would not stop. And I'll disappoint all y'all, but I ain't messing with God.
Right.
See, he could have come to me when I was in that bed and said, yeah, remember when you told me to go do something, you ain't do it. So now, no. I ain't messing with God. I ain't doing it. So, but now we're talking, which we didn't do before. I mean, we just been texting for the last year or so. And so, and she just called me, she called me on Father's Day. And it took me to my knees. And I thank God.
Amen.
For that simple act. Because you take things for granted.
Yeah.
And what do we talk about? Nothing. I was even more grateful to that we are nothing, because it's going to be, it's you all know that it's a process. Mm-hmm. She has to get used to just talking. Mm-hmm. Plus she knows, be careful, because if she brings something up, I'll talk about it. I don't think she really likes conflict. But I told her, this is not conflict. Speaking the truth is not conflict. You know? But she'll get there. She'll get there. Yeah.
This is going to open up the door to so many father-daughter, father-son conversations that had not been had.
Important. We are so important. See, as important we are to our sons, we are tremendously important to our daughters, because they got to understand what kind of man they need to deal with or avoid.
Mm-hmm.
You know, and that is the biggest thing that I look at with my daughter. I said, I wasn't there to give her that input. Now, the truth of the matter is I was there the first 5 or 6 years, you know, on and off. But, you know, I look at the trajectory of her life and it might not have been any different. You know, I don't want to give myself too much importance, but the fact of the matter is I was not there to give that input. And I tried, I did what I could, I was unsuccessful. And I've learned to forgive myself for that. But I'm still well aware of the void that's there. And the thing that I tell her, I can't do anything about the past. But if you think that void is gone, you're sadly mistaken. It ain't. And it may become even, as you said, time doesn't heal all wounds. Sometimes it makes them worse.
Yeah.
Mm-hmm.
And I'm waiting for the day when she is healed, or at least better. And I think it's happening. I think, and I did not, the two things I want to ask you, one, how did you find out I was sick? And two, why did you call? Not for me, but for her.
Mm-hmm. That's good.
I know she loves me. There's no question in my mind she loves me. She ain't got no choice but to love me. But does she realize that?
Yeah. We are
If you
grateful for those steps.
Because that heals. When you start realizing stuff like that, that's healing. I mean, that can wipe away. And you've seen it in therapy, when they get that epiphany, things are just wiped away instantly.
Mm-hmm.
And maybe she has, maybe she hasn't. She's too stubborn to tell me, but yeah. But anyway, I could talk about this all day. I could.
So we have a few minutes left, Dr. Freeman and Shonda. So I'm just kind of really at a loss for words right now. There's so much I want to ask, but I'm like, wow, because I feel like I'm sitting in front of my own father,
Mm-hmm.
who covered up a lot of things, who was the macho. I'm going to keep it all together, and I'm not going to tell anybody how I really feel, until he ended up on life support last year. And I flew in to see him, and I'm daddy's girl. I always have been. And so when I flew in to see him last year, I remember sitting there for a few days, and I would sing to my father, and I would read the Bible to him, because I remember as a little girl, he used to have me read the Bible to him. You know, certain words he couldn't understand, he would just have me sit there and I would read to him. So I remembered those things as I'm sitting there. And I remember when he came to, and he looked up and he realized that it was me standing over him. And he wailed like a baby.
I understand that feeling.
I never
understand. I understand.
I had never seen this man cry before. In his late 60s, never seen him cry before. But when he saw me in that moment, he burst out like a baby. And then he began to get better. So I can understand exactly what you're talking about when you say.
I understand. And that doesn't take anything away from my other two children, nothing. And I tell people, this daughter, this thing, she brought out the father in me, because I was forced to have to understand what I got to do. And it brought my parents out in me. These other two kids taught me how fun it could be to be a father.
So
but I understand why your father did what he did. I understand it. I know that love. Yes. Same thing happened to me. I told you, I didn't realize, Lord, have mercy. Wow. You see the power you have? You see the power that love can, it's so powerful.
It is.
But it didn't destroy anything. So it don't look, okay, now if he'd blown up, wow. No, something that takes much more energy, effort. He got better.
Mm-hmm. And that's how the world is going to be healed, by love.
Oh, yes. Oh, yes. Oh, yes. Mm-hmm. Now, we may have to shove it down some people's throat, but.
Well, that's another topic too.
Well.
So in these last few minutes, I don't know who wants the floor last, but in these last I can give you 2 minutes each. What would you say, Dr. Freeman, to the man who is struggling with his identity, who does not know who he is or where he belongs within himself or in the life of his family? What can you tell him in this moment, in this hour?
Well, if he has a family, he belongs to that family. If he's not sure where he belongs in that family, that's when it's time to have a discussion. Now, discussions have to be age appropriate and whatever. If he has a spouse or parents or siblings, then talk to him. Don't be afraid to show your insecurities, because every single body has them.
Absolutely.
You have to be careful who you do it with. And to be honest with you, things aren't going to, probably what's going to happen isn't going to be worse than what's happening to you already. You're eating yourself up from the inside. And don't be afraid to face yourself. Like I said, when I faced those fears in that hospital with that COVID, they weren't even frightening. I was surprised. I'm like, ain't I supposed to be afraid of you? Yeah. No, what I was afraid of was the unknown. What I was afraid of was the fear. So, and if all else fails, get yourself in with a counselor, get a therapist. If you need that neutral third person, get in there with them. Mm-hmm. And God works too,
He sure does.
Mm-hmm.
Above all things, he works.
Oh yeah, above all things.
Yes. All right, Shonda, what you got?
Girl, I'm trying to stay collected over here. I don't have a whole lot, but I just want to very candidly just say this really quickly to everyone that's listening. So Dr. Freeman graced us with his presence on today to tell us a lot on today. He gave us so many pearls of wisdom, but there's two things that if we could take this away from this podcast, I want everybody to hear. Number one, COVID is real. Okay. And so for anybody who thinks that it's a hoax, that it doesn't exist, that it's a lie, that it's whatever it is that people think, we have someone bona fide who is on here with us, speaking with us today about what he experienced during that particular time and about how he almost didn't come back from that experience. So know that it is real. No, I want you to take it seriously, right? But I don't want you to panic. I want you to remember that love covers a multitude, right? Not just sins, but it covers a multitude of things. It covers relationships, it covers sickness, it covers people. God is love, which is why love is so powerful, because the master of the universe, the one that created all things, both heaven and earth, is the source of love. So it's so powerful. And know that same God that created that heaven and that earth sees you where you are and will bring you back if that is within his will. So just know that you're not without recourse. And thank you so much, Dr. Freeman, for being on here with us today. I am forever changed for having been in your presence today. So thank you so much.
Well, thank you for having me, and thank you for tolerating me. So
we're going to have you back for some other special segments.
Absolutely.
Well, we still need to talk about men's health. We hopefully we've helped people, but we didn't talk about the nuts and bolts. But I really didn't want to just touch on the diabetes, high blood pressure, obesity. Y'all know, we got that. Y'all know what to do.
But
you talked about some important things today, Dr. Freeman, and you did talk about men's health. You just didn't talk about necessarily bodily health, but you talked about some emotional and spiritual health for men, which is something that they desperately need as well. I think sometimes if they could get that emotional and spiritual health together, that physical health might not give them so many problems.
They often do get better then.
Yes.
Yes.
Yeah.
I agree.
Yes.
Thank you all, ladies. Thank you all so much.
You are so welcome. We are out of time. Y'all have been listening to Prison Break with Shirley and Shauna with our very special guest, Dr. Edward Freeman. You need to hear this and see this from the very beginning. So if you have not, go press rewind, get out whatever it is that you need to get out and go back and listen to this again. Next week, we are going to be discussing being clergy, but yet men, with our very own Pastor Rodney Gilchrist from Liberty Christian Center. So y'all keep it locked on 98.5 KRGN, The Rock.